Chrissy Thomas with About Face Skincare, and I wanted to take the opportunity to discuss volumizing fillers. I have a lot of clients that come in and they tell me that they feel like their face is sagging and the face shape has changed. And when I recommend volumizing fillers, such as Voluma and Juvederm, Restylane, things like that, they don't like the idea because they feel their face is going to be even fuller and the jowl situation is going to be worse, or they see the Hollywood cheeks that they don't like that are really big and full. So I want to take the opportunity to show you a little bit about this process with Susie, and Susie is our office manager. She's never had any sort of filler or Botox done before, and so she agreed to be my model today. Yay. So I'm going to do a little bit of drawing on Susie, but one thing I like to do with my customers is to ask them to bring photographs from their earlier years. So Susie brought me some photographs from her 30s, 40s, and later 40s. Susie is now 59.
Yes.
She'll be 60 next year. So it's interesting to see a face shape because we don't want to change a face to be a different shape. At About Face, we focus on restoring to where the face was naturally. And looking at Susie's photograph, she has always had a little bit fuller area in the lower face, and her cheeks have always been fuller right on the front there. So we don't want to change those two beautiful features about her face. So whenever I'm looking at Susie, and we've seen that she's a little bit fuller here than she used to be, but she's always had a little bit of natural fullness and a little bit of a recessed chin here. What's happened over time, though, is the volume from the back of her cheek has decreased. We lose facial fat over time. So we're seeing that she has more fat in the lower part of the face here. And if we add some Voluma, which is one of my favorite products made by Allergan, we can lift the cheek back up and out and open Susie's face back up. As we age, everything tends to try to deflate and sink inward, and we all lose a little volume here. No one's immune to this. So if we can reverse those two factors, we're going to open up her lip just a little bit. She doesn't want lips, and I'm not a fan of big puffy lips, so we're just going to do a little bit of volumizing around the mouth area to restore that natural lip line, and that'll give her some more body to the lower face, put her in better balance. This part of her face is a little bit smaller than her cheek area. We're going to do just a tiny bit of Botox because she's always had a more hooded eyelid, just to kind of open her eyes up and out a little bit on the corners. My goal is to keep her very natural, but give her a look like she's had a great nap. We might even do just a little bit of work right in the tear troughs here. I always like to make my plans as I go and kind of see what I want to do through the plan, offering as little as possible in the way of filler, and then I see the customer back in a couple of weeks and we just reevaluate and see if we need to add a little more. Today we're using all hyaluronic acid products, and the benefit of using hyaluronic acid is that we do have material that will break it down. If it turned out to be something that Susie just did not like, we could get rid of it in just a couple of days. It's another solution that we can inject. So that is not only a safety net as far as safety features go with the product, it's also a safety peace of mind for the customer as they're going into something different. So I'm going to draw some lines on Susie. Actually, when you look at me, it's a little easier to see the camera. And so what I've done is I've drawn the lines on Susie's face that tell me where the fullest part of her cheek should be, right here at the apex of the cheek. I'm going to turn you back around. If you look, Susie's face is now fuller along the apples of the cheek, and that is telling me that a lot of this volume has deflated and she's fuller here. So what I would like to do with our filler is to just work on the back edge of Susie's cheek to help lift this jowl area up and back, and then give her a little more volume here in this marionette area. Okay, so first we're just going to cleanse Susie's face. She's already washed, and I'm just using some alcohol to wipe the area that we're going to inject. So we finished doing a syringe of Voluma to Susie's right cheek, and you see that she's not fuller here at all. You don't really notice anything obvious from the front that she might be fuller here. She just has a nice contour now. But if you look at her from the front, you can see that this whole side of her face is lifted up and back a bit. And so now what we're going to do, just so that we can show the difference in the two sides, is go ahead and do a little bit of filling in this area, this marionette area where she has a little bit of volume loss there. Okay, so we can see that we have started doing a little bit of fill in this area on Susie with a Juvederm Ultra Plus because we want to give her a little bit more volume back to this marionette area. And you see she's just a little pink where I've been kind of rubbing and massaging on her. And we're going to continue on the other side now, but I just wanted to show you how it looks in the beginning. These products are hydrophilic, which means that they absorb water once they're injected. So it looks different now. It's going to look better in a couple of hours, better in a couple of days. And that's why we give it a couple of weeks to settle in, let the inflammation clear before we take a look and see if we want to do anything more. Okay, so we finished with the injections on Susie's face, and she looks great. She's not got a lot of use of her lips right now because she has a lot of lidocaine in her face right now, so everything is still kind of numb. I'm sure she feels really big right now.
It does.
What do you think about the pain level, 1 to 10?
I'd say 5.
Okay, not too bad?
No, really.
Okay.
Well, a lot less than I thought it was going to be.
Oh, good. That's good. That's good from a first timer. That's good to hear. And I do want to show a couple of things on her face. So if you look closely on Susie, you see that the little area that was fuller here is now lifted up and back. The lines around her mouth have been addressed and they look much smoother, yet that's going to, in a couple of days, couple of weeks, everything is going to really lift and look even better than it does now. We gave her just a little Botox here in the center and around the crow's foot area just to give her a little bit of a brow lift. So what we want to do is come back in a couple of weeks and just show a photograph of Susie so that you can see kind of what the outcome was here. So thank you for joining us today. It's a good opportunity to see how injectable fillers can actually thin the face rather than adding volume to the face. And if you have any questions about today's treatment or any of the other products or services that we provide here at About Face, check out our YouTube channel, About Face Skin.